Many believe that type 2 diabetes may be a life sentence and in many cases a death sentence, but this is not the case. Joanna Engel is here with me today talking about the benefits of utilising nutritional therapy and functional medicine to improve the symptoms and potentially reverse type 2 diabetes. Hi Joanna. So can you tell me a bit about type 2 diabetes, its etiology and its complications?
Well, recent statistics show that the number of people diagnosed with type 2 diabetes has doubled in the last 20 years. However, these stats do not even take into consideration those that are with undiagnosed diabetes, pre-diabetes and insulin resistance. So obviously this kind of rise is concerning and shows a need for sort of more effective preventative and therapeutic measures. Type 2 diabetes is horrendous because it disrupts many aspects of human physiology, as elevated levels of insulin have been found to increase inflammation in the body, leading to destruction of tissues in the retina, so the eyes, the nerves, the kidneys and also the blood vessels. So it can also affect hearing and leads to many skin conditions, sort of bacterial and fungal. Type 2 diabetes also increases the risk of cardiovascular diseases, so you're more likely to potentially have a heart attack, certain cancers, as well as being now associated with a reduction in cognitive function, so the development of things like Alzheimer's. It's also associated with an increased risk of non-alcoholic fatty liver disease. So as you can see, type 2 diabetes has some quite serious implications. A rise in the cases of those with sort of blood sugar imbalance is definitely a modern day phenomenon because of the lifestyle that we're leading.
So can you tell us how or why does type 2 diabetes develop?
Well, before a person becomes a diabetic, they go through a stage called insulin resistance, and this can go on for sort of many years. Insulin is a hormone made by the beta cells in the pancreas, and it's secreted into the bloodstream after a meal's eaten. Obviously, I've already mentioned insulin is pro-inflammatory hormone, and it helps fat and muscle cells to get glucose from the blood, so everything you eat will be turned into glucose. Chronic or elevated glucose levels are caused by sort of diet and lifestyle, so eating the wrong foods, not exercising and so forth, will lead to excessive insulin release, and over time this affects the insulin receptors on the cells. They become less responsive to insulin in the bloodstream. So you've got these elevated levels of glucose, elevated levels of insulin, and your body fails to convert glucose to use by the muscles and tissues in the body, and eventually this then leads to pre-diabetes and over time and diabetes. So it's like an ongoing issue. So once you are insulin resistant, your cells just do not respond to insulin at all, and you have this huge accumulation of glucose in the blood. So it's really important to improve your insulin sensitivity, and then you don't require as much insulin anymore.
So what are the triggers for insulin resistance?
So obviously a poor diet, eating the wrong foods, inflammation, toxins. So we're surrounded by toxins from chemicals and so forth. Excess weight, especially that sort of around the middle area. Being sedentary, lack of exercise, smoking. There's many factors that can increase your risk.
So what happens once type 2 diabetes is actually developed?
Conventional medicine's approach is to focus on recognising a specific set of symptoms and lab values, and then that qualify for a particular diagnosis, and then prescribing medications, something such as metformin, to manage the condition. However, if you're only concentrating on treating the symptoms, then you will never get rid of the disease. So that is an issue.
Right. So what can be done to prevent type 2 diabetes?
Preventative measures are, looking at somebody when they've just got insulin resistance, tackling it at an early stage. From a functional medicine viewpoint, finding the root cause of why that person, because everybody's obviously different, why that person has developed type 2 diabetes, and that can be down to hormone imbalances, infections, organ dysfunction, a combination of factors really. So having a sort of more holistic approach and looking at other areas is quite important. Stress has been shown to be a major factor because this increases blood sugar as well as decreasing insulin receptor sensitivity, so helping people to manage their stress. Sleep deprivation as well has been found to disrupt glucose metabolism, decreasing insulin sensitivity. And now we're finding out that actually the gut bacteria has been found to trigger inflammation, activating certain pathways that increase insulin resistance in the body. So improving that balance of gut bacteria is really, really important. Furthermore, addressing issues such as food sensitivities, which can also cause immune and inflammatory responses. I imagine many people have food sensitivities that they don't even know about. In addition, sort of having elevated insulin levels can prevent the liver from being able to detoxify properly, so supporting the liver is important. And just dealing kind of with all the inflammation in the body.
So what else can be done? What steps does a person need to take?
I think to start with is to gain some real insights. Maybe it'd be useful to utilise some functional lab testing. So obviously your GP tests aren't maybe as sensitive as the ones offered in a functional practice, and finding out when you just have mild elevations of glucose or insulin and then dealing with the issue at that stage.
So what can be done to improve insulin sensitivity?
So doing an extensive evaluation of your overall lifestyle and health history is a really good place to start. You can start off by paying attention to the glycemic load of foods, so looking at the quality and quantity of carbohydrates, as well as sort of adopting a more Mediterranean diet and consuming good fats, fibre, more fruit and vegetable, and of course avoiding sort of more processed foods has been found to help. We know now functional foods, sort of polyphenols, flavonoids, pre and probiotics, and fermented foods offer lots of benefits due to their antioxidant and anti-inflammatory mechanism. They've been found to prevent and manage type 2 diabetes. It's also really important to address any vitamin and deficiencies and hormone imbalances such as thyroid and adrenal. Increasing exercise, I mean that's a big one. Getting people to be more active, which helps control sort of hunger cravings and hunger signals.
Right, so how does functional medicine differ from mainstream approaches to healthcare?
Functional medicine is an approach that seeks to discover the root cause of an issue and restore balance to the body, not just mask the symptoms with medication. So we're always trying to find out why this has developed, and obviously taking consideration that everybody's different, so everybody has a personalised plan. There are no sort of two diabetics who will have the same cause. Functional medicine has been shown to sort of even reverse the symptoms of type 2 diabetes. So you'd be addressing diet, physical activity, gut health, as I say, liver health and so forth. And increase foods that are beneficial. So I hope that kind of answers all your questions.
Thanks very much, Joanna. It's been really enlightening. I've really learnt a lot, and I'm sure others will have as well.
Okay, thank you,
Thank
Natasha.
you. Thank you.